I'm Dr. Berry, licensed psychologist, and if you're wanting to learn how to deal with anxiety, stay tuned for this book review. Anxiety Audit by Lynn Lyons is a phenomenal book, and it really provides practical insights and strategies that people can use when dealing with anxiety. And she's a therapist that has been working with clients for over 25 years, and she presents very clear and concise ways to address anxiety. This is a quote from the book, and it says, "Anxiety is a normal human experience that everyone faces at some point. We need to stop viewing anxiety as a weakness or character flaw and start seeing it as a natural response to stress and uncertainty." And we have seen an increase in anxiety not only in adults, but also in children and teens. And they are growing up with 24/7 news that's constantly saying, this is what's going on in the world. This is what's going on here. This is what's going on there. Another follow up video that I'm going to do is on teen mental health because kids are growing up and they don't have any hope. They're not looking forward to the future. And it is increasing really, really dark thoughts and depression for them. And anxiety can lead to other more serious emotions. And so I think being able to manage it, because what people often want to do is avoid it. And a more healthy way to look at anxiety is that it's like an alarm system that's easily triggered. And once it's activated, it can be tough to turn it off. But it's important to remember that anxiety isn't necessarily a problem in and of itself. It's a signal that something needs attention. So just because the alarm is going off doesn't mean that there's an issue. So once one of our doors was left slightly open and it made the alarm go off, the police showed up, like became this whole big thing, but there was no danger. And we were able to resolve everything quickly. And it is unrealistic to try to live a life with no anxiety, avoiding it and trying to hide from it. And in our world, we are trying to have certainty and control. We want to know what's going to happen. And Lynn Lyons talks about the fact that anxiety wants safety, certainty, and control. And when we are looking for those things, we are practicing the disorder. We are doing what anxiety wants because that will keep us from doing things, that will keep you from going places, that will keep you trapped and not living the life that you want to live. The book is organized into three main sections, and each one of these addresses a different aspect of anxiety. The first section looks at the science of anxiety, including how it develops and why it can be so difficult to overcome. And she really uses practical language in a way that is easy for therapists to understand and provide a resource to clients, but then also for individuals, just any everyday person, to be able to understand it as well. She takes out all of the mumbo jumbo, all the clinical terms and things. And if she is using a term that's more clinical, she explains it. And one of the first tips that I wanted to give from the book is that the goal is to change our relationship with anxiety by viewing it as a signal that something important needs our attention. This can help reduce the power that anxiety has over our lives and make it so much easier to manage. Because instead of saying, I'm not anxious, I'm able to say, okay, my anxieties come up. Now, is it important? Is this something that I need to attend to? Or is anxiety just playing the games that it plays? And is this something that I need to step away from? And instead, embrace that uncertainty and embrace discomfort, which some people have probably already turned off because we don't want to do things that are uncomfortable. But if you're going to learn how to manage anxiety, there are going to be times when things are going to be uncomfortable. So I recently came back from a conference and she spoke, and I haven't listened to her presentation yet. I have 2 weeks to do so. But one of the things I had to move through was being on public transportation. I decided to not wear a mask, and each person can manage these things as best they feel based on their health and what's best for them. I did take COVID tests with me just in case, but it was different traveling with no mask. So last year, I didn't even go to this conference in person because I wasn't comfortable being out in public places and around thousands of people yet. But now our family was in a place where we were comfortable taking that step. And when you first start to do things that you haven't done in a while, that is going to be uncomfortable. And anticipating that discomfort and moving towards it instead of away from it can help you move forward in a healthy way. So it was really great to get to connect with colleagues and get to see presentations from presenters that I've either never seen or I was excited to get to see again. Another quote from the book is that anxiety thrives on avoidance. So the more we push it away, the more it persists. The key is to learn to tolerate discomfort and uncertainty without letting anxiety take over. And for me, I personally practice what's called dialectical behavior therapy skills, DBT skills, and I practice being in the moment. I practice increasing my frustration tolerance. There are specific skills that I use that help me. If you want more on DBT skills, I can do a video that talks about that. There's also a phenomenal YouTube channel that I will link down in the description that already has a lot of DBT resources there. Within the book, she talks about externalizing our anxiety because often anxiety and worry have sometimes become such a part of us that it feels like us. So I'll have clients that come and say, I don't like to be around people. And really, it's they don't like the anxiety that comes up when they're around people. Or they say, I don't like going to the stores, or I don't like doing this, or I don't like this. But really, that's the anxiety talking. That's not them. And Lynn Lyons talks about naming the anxiety and giving it its whole persona so that when it pops up that you're able to speak back to it instead of feeling like it's such a part of you that I just have to give in to anxiety because I can't manage it. And I like to use the analogy of driving the car, that anxiety wants to be at the wheel because when it's at the wheel, it might let you be okay, but it's going to go wherever it wants to go and it's going to do what it wants to do. And for me personally, I want to be in the driver's seat of my life. And if that means sometimes anxiety being a little frustrated, anxiety popping up, and maybe my heart beating faster, getting a little tense, that I'm having to manage some of the physiological effects of anxiety or some of the thoughts that pop up when I'm doing something that's uncomfortable or that's bringing discomfort. But learning to manage that and move through it to do the things that you want to do. And in the book, she talks about focusing on what you can control. Because when it comes to anxiety, it's easy to get caught up in worrying about things that are out of your control. There are lots of different versions of this image, but it talks about what I can control and focusing on these things and letting go of the things that I cannot control. So I can't control how long something will last, how others react, or how other people feel. I can't predict what'll happen. I can't control how other people handle things, but I can control my attitude, my thoughts, my feelings. I turn off the news. I'm very careful at night about what I watch before I go to bed. I might limit my social media. And so being able to focus on what is within my control, because the more I try to control other people, that's anxiety. Now, with my child, so there's a balance because I'm going to provide direction, but I have to accept that I can't control. And there's a whole other video that I'm going to do on toxic shame versus healthy shame, because sometimes with anxiety, we're fighting against shame as well. But that's a whole other video. So, when we're anxious, we often get stuck in a loop of negative self talk and catastrophic thinking. And catastrophic thinking, that's just the worst possible case scenario, like the worst thing that could possibly happen. To break this cycle, we need to focus on what we can control and take small, deliberate steps towards our goals. The second section focuses on practical steps that people can take to manage their anxiety, including identifying triggers, building coping skills, and developing a support system. Something that I really wanted to highlight is the importance of self compassion. So, in the book, it talks about how people with anxiety often struggle with self criticism and negative self talk. To counter this, she recommends practicing self compassion by speaking kindly to oneself, acknowledging that everyone makes mistakes, and treating oneself the same and treating oneself with the same care and kindness that we would offer to a good friend. So when my clients come in a place of self criticism and negative self talk, I would often ask, what would you say to a friend that was in the same exact situation? Because for many of them, they would be a lot more kind, a lot more patient, and a lot more gentle. And so being able to give that to ourselves, that can help reduce the anxiety. Because if I'm thinking, I got to do this perfect, if I have this perfectionism, if I'm so focused on getting it right all the time, like I can feel my heart rate increasing just saying that because that puts you in a state of anxiety. And here's a quote that beautifully illustrates this point. We all have an inner critic that tells us we're not good enough or that we're doing something wrong. But when it comes to anxiety, that inner critic can be particularly loud and persistent. That is why it's so important to practice self compassion and speak kindly to ourselves. I also like the fact that the book points out that we can validate the fact that anxiety can be overwhelming, but it doesn't have to be all consuming because that's where it's giving you a choice. It's giving you an option that I don't have to give in to every whim of anxiety. Or just because I have anxiety, that doesn't mean that because of that, I don't do these things. That if these are things that I would like to do, that there are practical ways that I can work towards that thing that might be really uncomfortable. By learning to set boundaries, prioritizing self care, and building a sense of mastery over our lives, we can take control of anxiety rather than letting it control us. And I like the fact that she brought community into it, that with a support system, having friends, family, professionals, that can be an invaluable part of managing anxiety and making sure to proactively seek out these supports and strengthening those relationships that are helpful. And sometimes it can be helpful to let them know like, "Hey, I'm working on these things and my anxiety, I call it this," like whatever persona you've given it, so that when other people hear it come up, they can call out, that sounds like your anxiety, whatever that name is. If I'm calling my anxiety Bob, or that sounds like Bob. Because, and that can be a playful way to redirect someone to realize, oh, I'm doing anxiety right now, so that they can shift. They can decide what they want to do next versus letting anxiety take over and make the decision for them. And here's the quote that goes along with the support system section. One of the most effective ways to manage anxiety is to build a support system of people who can help us through the tough times. Whether it's friends, family, or professionals, having a network of people we can turn to can make all the difference. Another thing that she talks about is identifying and challenging anxious thoughts. That anxious thoughts can quickly spiral out of control, leading to increased anxiety. And she really talks about thinking, is this thought based in reality? What evidence do I have that contradicts this? And the type of therapy that comes from is cognitive behavior therapy. I personally like adding validation to it based on my history, based on what I've been through. It's valid that this anxiety is coming up. And then I need to look for clues of, is it correct? Because even if a feeling is valid, it doesn't mean that it's accurate. And what I mean by that is, because let's say I'm feeling like my friend doesn't like me, but when I go to them, they're like, oh no, like we're fine. Like, no, I had a lot going on. And so that's why I didn't call you back like I normally did. So just because I was feeling a certain way doesn't necessarily mean that it was true, but I want to validate the feeling and at the same time make sure that it's accurate, because feelings aren't facts. They are real and valid, but they're not facts. I get to balance the two. And that's what dialectical behavior therapy does a good job of helping balance feelings and emotions. And they call it wise mind, walking the middle path of not being so emotional that I'm all over here, or not being so logical that I'm ignoring the emotions, but being able to walk both and that I can feel two things at the same time. I can be anxious and excited. I can be anxious, sad, and hopeful. That anxiety doesn't have to take over everything, because it does like to, it does try. And that taking this approach to anxious thoughts can help put them into perspective and reduce their power. So I'm not saying, and she's not saying, to be reckless and go out and do things that, because a little bit of anxiety helps keep us safe. Too much keeps you strapped in, locked in, and you never ever do anything. You never go anywhere. You're not living the life that you want to live. And then finally, the third section offers guidance for working with professionals to receive the help needed to overcome anxiety. Because, and this is where her approach is totally different than how I was trained to help people with anxiety. That a lot of the things that therapists were trained to do actually accommodated the anxiety. So earlier in my career, if I was working with a kid that had fears of the bus, we would initially just say, okay, let's no bus. And then the goal would be to work them towards being back on the bus. But once they avoided that thing they were afraid of, it became incredibly difficult to get them back on it. Now, if they experienced a negative event, like a major thing on the bus, because sometimes trauma can add and make this more complicated, because I do need to honor that. And at the same time, I also have to make sure that we aren't reinforcing the thing that we're trying to avoid. And so maybe if my client is afraid of the regular bus, how can we maybe still get them on a bus, but maybe it's special transportation? Maybe we're able to make some adjustments where they're still moving towards the thing, but it's within their zone of proximal development. And what that talks about is the fact that we have a gap where we're able to learn and grow. And then some things that are outside of that, where it's just, no, I'm not going to do this, even with support. This is just panic zone. I just can't do it. Well, I want to make sure that I'm challenging them and not completely accommodating everything, and helping them move towards their desired goal. Because sometimes the goal is to avoid anxiety. And as a therapist, if I'm helping them avoid everything that makes them anxious, then that's actually making things worse. And I don't want to make things worse. And throughout the book, she talks about how instead of talking about all the different, the content of anxiety, getting to that root, getting to the core. Because sometimes if I'm working with a client that has anxiety, well, every week it'll be something different that's causing the anxiety. But what's under that is helping them tolerate discomfort, helping them move towards feeling more empowered in their ability to speak back to their anxiety. And she provides a lot of great stories from her own life, and just the way that she writes. She does provide these engaging anecdotes, relatable examples, and practical exercises that can really help you apply what she's saying to your life. So it's important for us to remember that anxiety isn't a one size fits all experience. What works for one person may not work for another, and that's okay. The key is to be open minded, curious, and willing to experiment with different approaches until you find the one that works for you. And that is where I think her book does a really good job helping people address anxiety in a way that seems doable. Because for a person that's had anxiety all of their life, if the goal is to never ever have anxiety, they might lose hope. They might think they're not getting better. But if we can say, last time you were here, you would have never went to this. You would have never done this thing. If we can measure their growth, I think that can really help. And another helpful quote from the book is, to truly overcome anxiety, we need to learn to tolerate discomfort and uncertainty without letting it dictate our lives. This means getting comfortable with feeling uncomfortable and learning to take risks despite fear. Because I think people don't want to be afraid, which is normal. Like, ooh, but in approaching discomfort, it helps us live a life that's more consistent with what we want. And then my last quote from the book Anxiety can be a tricky beast to manage, but it is not impossible. By taking small, deliberate steps towards our goals and building our coping skills, we can learn to manage anxiety in a way that allows us to live the life we want. So that's truly my hope for you and my hope for anyone listening that does struggle with anxiety. And who doesn't? Like we all have anxious thoughts. Anxiety is something that we all have. And some people meet criteria for particular diagnoses. And she is an expert that has worked with individuals that have medical anxiety, that have anxiety around a lot of different things. And taking this approach has been helpful. She also wrote a book called Anxious Kids, Anxious Parents: 7 Ways to Stop the Worry Cycle and Raise Courageous and Independent Children. And this was written with Reed Wilson. Reed Wilson also has a book called Stopping the Noise in Your Head: The New Way to Overcome Anxiety and Worry. And these are all resources that I've recommended to clients, especially the anxious kids, anxious parents, if I'm working with an individual that does have an anxious teen or child, or even an anxious adult, that as the parent, that I have to learn how to manage my anxiety and how to tolerate my child having anxiety too. And when I say tolerate, what I'm saying is often if I have anxiety as the parent, I want to take their pain away. I want to make sure they don't experience pain. And that's a normal parent thing, but that doesn't give them the ability to learn to manage it themselves. And then the parent always has to be there to help them manage it, that they don't learn to talk back to their anxiety. So when my 5-year-old talks about being afraid at night, I ask him, what can you say that? What can you say back to that? That sounds like you're worried. What can you say back? And he'll often think. So last night's thing was he was going to fart on the bad thoughts. Like that was that was his thing. He's 5. He got a good chuckle out of it. I gave him a kiss and he stayed. He went to bed. And every kid is different, but being able to give them the tools so that they can manage it, that will help things down the road. Because while we do live in a world that is uncertain and unpredictable, and we don't know what's going to happen, we do have certain things that help create safety. And safety isn't guaranteed because I can do all these things and some things still happen. And so, how do I tolerate uncertainty? How do I live with that? And she gives really practical tools to help people navigate that process. If you have questions about this topic, let me know. I either answer them in the comments or I'll do a short video or longer video if it's can't be summed up in a minute. If you stayed till the end, YouTube recommends you check out this video, and I hope you enjoyed.